Welcome to the Healthy Lifestyles Podcast, located here in Northwest Phoenix, Glendale, and Peoria. My name is Dr. Nick Hunter. I'm a doctor of physical therapy, and I own and operate Preferred Physical Therapy, where we have helped hundreds of people aged 40 plus stay active and independent, live free from painkillers, and avoid surgery, even if they've had pain for years. I've written over 8 ebooks on how to treat common injuries and hosted numerous webinars, all in an effort to help educate the public on how to care for and maintain their bodies to live with joy, dignity, and without compromise. This podcast is intended to help you make better decisions about your health so you can find joy in the journey by bringing together top healthcare providers, fitness experts, and nutritionists in the area to give you the knowledge and confidence needed to make good health decisions. Thank you for joining us today, and I am excited to introduce our 2 guests today. Dr. Anne-Marie Feyrer-Melk is redefining what a cardiology practice can be. She recognizes that trust grows from deep diagnostic knowledge and effective solutions-oriented treatment available only through a hands-on concierge approach. Dramatically improving the lives of her patients is paramount, from discovery to diagnosis to treatment. She instills confidence while providing the compassion and emotional strength patients need. Dr. Feyrer-Melk's concierge practice, Optimal Heart Center, provides the most advanced diagnostic and therapies in heart attack and stroke prevention available today. She's the first and only cardiologist in Arizona to design a program to provide screenings, specialized technologies, and the research time necessary to comprehensively evaluate heart and blood vessel health and identify and assess cardiac risks before tragedy strikes. Anne-Marie Feyrer-Melk, MD, has been in practice since 1997. She received her medical degree from the University of Wisconsin Medical School and her internship, residency, and fellowship training at Banner Samaritan Medical Center in Phoenix, focusing on cardiovascular diseases. And we're joined by Dr. Steve, a PhD from Arizona State. Combined with the best of exercise science and wellness with the practicality of curriculum and instruction, Dr. Steve has a successful history practicing within a cutting-edge medical business and serves as the director of lifestyle medicine at the Optimal Heart Center. He is a highly sought-after consultant and leader in the field, and Dr. Steve works with medical practices to develop and implement lifestyle programs and place and train staff to serve as health coaches to meet the needs of the medical practice. I think it's a fantastic combo and duo that you two present from a standpoint of prevention and really life-changing results. Tell me, did I miss anything in that introduction?
No, that's very nice. Thank you so much.
I think it's wonderful. And I think there's a lot more description that needs to go in to what exactly is going on over at Optimal Heart Center.
Well, the big word is being proactive. I mean, that's the big thing. And I know, Dr. Nick, you're really into the proactive part of it and getting ahead of the game so that we can find problems before they actually happen. Or if people do have problems, we start to improve those so that they're able to get out there and live life to the fullest. I love when you said, what, if I can paraphrase, what brings people joy and keeping them happy and letting them live fulfilling lives. And that's what we're all about. The cardiology and the lifestyle medicine part are just to support all that. Is that right?
Well, true. And in this era of COVID, there's not very many things about COVID that are good, but one of them is that people are putting health at the forefront and people are thinking about it more, and they're looking at their own risk factors and what can they possibly do. And despite all the numbers and so on with COVID, I mean, cardiovascular disease is still our #1 killer. So COVID's #3, but still heart attacks and strokes are #1 killer. And those are things that are absolutely preventable.
And I think that's one thing that we need to talk more about, because people hear that it's preventable and they want to know, like, how, when, at what point can I prevent these kind of things from developing? We talk about cardiovascular disease and we can talk about why they're so interconnected, because I think a lot of folks don't quite understand that. So let's back up and say that. Describe to us, based on your experience, why cardiac disease, heart attacks, and strokes are together. Why those 2 conditions are linked together.
Right. I mean, so many of the medical problems that are prominent with Americans, like the diabetes epidemic, high blood pressure, tobacco abuse, obesity, a lot of these conditions, pre-diabetes and diabetes, these are all, they wreak havoc on the insides of the arteries, and not just the arteries of the heart, but the arteries of the brain and the intestines and the legs and all of these sensitive organs. So when we're doing a cardiovascular disease model, we're looking at healing the insides of the arteries. And so when patients are educated about the very specific things that they need to do for their health, and they can own those goals, both with lifestyle medicine or with a very elegant combination of prescription medicine if they need it, or supplements, there are ways to heal the inside of the arteries, and there's ways to measure that so it makes sense for patients.
Yeah, perfect. And so it kind of goes into if we want to get a little nerdy and talk about the physiology of how these cardiac conditions wreak havoc on the heart, and then how those then wreak havoc on the brain. You mentioned arteries, and how with this cardiac disease process that takes place where we have clots, or we have pieces of particles that will then dislodge in the artery and then either get stuck in the heart or get stuck in the brain. And whenever we close off blood flow or dam up blood flow in the heart or the brain, that's when we have these traumatic events, either a stroke or a heart attack. Is that right? Anything else you want to expand on that?
Sure. I mean, the inside of the artery is actually a very complex milieu. And we actually measure 5 different places inside the artery. There's the calcium that's inside the artery. There's the thickening the artery. There's the yellow plaque that can grow inside the artery. There's the inflammatory biomarkers, we call them, in the bloodstream that are inside the artery. And then there's something called a glycocalyx inside the artery. And we can measure and we can heal each of these 5 different metrics. And so what most people think is that a patient starts to develop a cholesterol plaque inside the artery, and that eventually that cholesterol plaque grows and grows and grows till it pinches off the artery and causes a heart attack. And that is one of the ways that people can have a heart attack. But the vastly more common way to have a heart attack is if you have a small plaque, a 40 to 60%er. We call those intermediate lesions. So those are the medium-sized blockages that if they get traumatized, if they get too hot, or they start to grow, they can actually rupture open and cause a heart attack or a stroke. So the point is, Dr. Nick, is that patients can be walking around with small and medium-sized plaques in their arteries, and they have no idea that they're high risk.
Otherwise unnoticed, undetected.
And what I always call it is it's silent and invisible disease. So patients have no idea that disease is there. Sometimes if a patient has a critical blockage, they're going to have some symptoms, and that's a gift. So they may have the classic chest discomfort.
One way to look at it, yeah.
Or if they're a woman, they might have just fatigue or energy problems. They might have some nondescript shortness of breath, some palpitations. There's many different ways that chest pain or angina can manifest. So sometimes that's a gift because those patients are brought to the attention of a physician first, and then the diagnosis can be made. But the vast majority of disease is not critical. It's silent. It's not causing problems. And so we can have dynamite in our arteries and not even know it.
And I think that's one of the things that we need to be talking more about, is that the seemingly, oh, I'm okay, everything seems to be fine, it's not broken, I don't need to fix it kind of mentality that we carry, when in reality is we should be checking these things out. We should be aware of them. And then we do need to be, even though it's not broken, we don't want it to ever break because the events are catastrophic at that point. Right. And so, Dr. Steve, is that where you come in? Oh, sorry, go ahead.
I was just going to say, to add to that, I mean, 50% of patients find out that they have heart disease at the time of autopsy. So
oh my goodness.
These
half.
Are numbers, but they're numbers that we can absolutely fix. We just have to do the right thing.
You know, Dr. Nick, it's wonderful that people are focusing more on their health and maybe being more proactive in terms of getting out there and exercising and walking and maybe trying to change their diet. But there's a lot of other factors that go into being healthy, and using lifestyle medicine as healthy. And it has to really be pinpointed, because how many of us have heard of people who look wonderfully fit, they exercise, they eat right.
They're not obese. They've been exercising for a long time.
Yep. And they don't wake up one morning, or they fall over dead. Now, it's not a matter of scaring somebody. It's a matter of looking in the right places. And unless you have kind of this combo, which I firmly believe in, that's why we're in our 10th year now, that you have this combo where people know what's going on inside them. And then they know if that physical activity, if that nutrition, if that stress management, if their meditation, if whatever they're doing is having a positive impact on the inside of their vessels and decreased risk. And so, as you said in the introduction, it has to do with the measurement, with having the data, and then using that data to better your lifestyle specific to that data. So you're not wasting your time in the gym or eating certain foods where it's not having an impact, or taking certain supplements that aren't having an impact. You want to pinpoint it more.
Oh, and that's a great segue into what we haven't quite discussed yet, is what is your model of care? Because it's very unique, and almost for us to not discuss it in detail would be, I feel like, a disservice to those listening, because you do go over being an actual practicing cardiologist in the practice, as well as someone who works as the lifestyle coach like you do, Dr. Steve. So describe to our listeners a little bit, what is it that you guys do, and how is it that you guys do it?
So go ahead.
I mean, the place to start for me with patients is I just need to ask them two questions. I need to know, where is their disease in their arteries? I don't say, do they have it? I ask, where is it?
Where is it?
The detective. So we do have some patients that we call primary prevention, that we put them through the ringer and we look at all of their arteries and we can find no disease. But those patients are rare. The vast majority of patients are in a category called secondary prevention, where they have plaque growing in their arteries. They didn't know that it was there because maybe they never looked before. They never needed to look before. So that's always the first question, is where's your disease? And I need to find it. And then the second question that patients need to ask is, how hot are my arteries? So what I'm talking about is not a temperature. It's talking about using these markers of inflammation. They're called inflammatory biomarkers. And we're getting really good at this now, because they have a myriad of very special elite types of blood tests and urine tests that can tell what's happening inside the artery and how inflamed is the inside of the artery. We can even tell if they're having heart inflammation, or if they're having brain inflammation, or just generalized artery inflammation. So I always start with two questions with every patient, and then everything revolves around that.
Yes. And there's a whole battery of tests that we do, but getting to what.
And you do these in clinic, right? You do these in office?
Sure.
So what's unique, and she started as a regular interventional cardiologist, heart caths and diagnosing and treating when it was bad enough. But that was, for her, began to be, if I can speak for you, began to be unethical, because she was starting to know of all these things to prevent it and to look deeper. So looking deeper with all these different tests allows her to find it, because, like she says often, and I say too, it's not normal to have any level of disease, whether I have a partial block or a 20% block, it doesn't make sense. That would be like you working with an athlete who has a torn rotator cuff, but it's only, 25% torn.
Right.
Well, it has to be treated, correct? So we work together with, she's doing the diagnosing, and then we work together with, getting them in and seeing what types of things that they would like to maintain in their lifestyle that are positive, and maybe make some small changes.
I think that's perfect.
As Steve said, it is never normal to have disease in your arteries. And I can't tell you how many patients will come and see me and consider the program, and they'll say, oh, I just have a little plaque in my neck, or I have a mild blockage in my heart. Well, since when did that ever become normal and acceptable to have disease?
Right, we're okay with that.
Right. Just because it doesn't need to be bypassed, or just because it doesn't need a stent, doesn't mean that it's not important. Yeah. So to me, those are seedlings, and we've got to stop feeding those darn things and teach patients how to stop feeding those darn things so that they never grow.
That's one of the things that we try and go over in our clinic as well. Like you kind of mentioned, Dr. Steve, of getting to the root cause. Like if you have a 20% tear in rotator cuff, you have some blockages in your arteries that aren't hot or needing to be taken care of from an emergent standpoint. It's recognizing the fact that, we can do some treatment to try and clear that up, but what's built in it, what's causing it, what led up to that event that now we have that tear, or we have this blockage. And it's only until we identify that, or exist in a model that gives us the time to be able to identify that and treat it effectively, does it even matter? Because so often, and we can go into why you left, the typical cardiology office of diagnosing and then intervening after the fact that they've had an event. Similarly, I was in a similar spot where it was like, why am I continuing to deal with people who are in the state? We're all in a regular state of decay. Others are in a more advanced state of decay. Others come to us because they are broken and there's no way out of this hole that they've gotten into.
Mhm.
And they think, oh, I have plantar fasciitis, so I just need you to treat my foot. It's like, well, how did you get plantar fasciitis in the first place?
Yeah.
It's not as though you fell off a ladder and we have a fractured heel and we're trying to, no, there's breakdowns up the chain that we have to work on and work through. Number one, identify and then work on to really appropriately treat this so that you're not having to buy insoles, go through surgery, go through injections, take pain pills constantly. It's like we're fighting the wrong battle. And I know in our previous phone call interview, that was one thing that led to this creation 10 years ago, led to let's get on the front end of this instead of the back end when it's no longer as fun or as rewarding.
And what you mentioned too is a key part of it. This conversion from the traditional diagnose and treat after the fact. The only way you can do that is by looking at the whole person, the root cause, and having the time to do it. So there's hours and hours put behind the scene to look at all this. And the one thing I like to use with Dr. Feyrer-Melk is that if you've seen the movie The Matrix, all these little things are coming out, and who can see through the matrix and figure it out? Well, when I go into her office after she's done a whole plethora of tests, she's got things all over the room, and she's pulling this out, pulling that out, and she's seeing how this interacts with that, how that goes with this. Okay. And then after, a few hours, it's, oh, here's the steps we're going to do. We're going to advise you to do to help decrease this risk. So it's the reason why it has to be in the model that we're at is really because of the behind the scenes times. I mean, yes, there's some advanced testing. Yes, it's not covered by insurance because of that. Doesn't mean they're not any good. Doesn't mean they're science-based, but it's the time involved. And when you're in the old traditional way, where you're just pumping people out, the old type of physical therapy, get them in, get them out, you can't really care for the patient like they should be.
Completely agree with you. And that's why when I heard that a cardiology group offers this kind of medicine was just exciting to me. I was floored by the idea of it, because when you mentioned the fact that these are life-altering events, a heart attack or stroke, you no longer live the same kind of life after those events. And half of them are diagnosed in the morgue upon autopsy. The other half don't even know what's going on. It's the silent killer. There's no presentable, I shouldn't say no, because we did talk about the fact that you're lucky if you start to have the chest pain, if you start to have the fatigue, and you're that sensitive to then pursue some sort of diagnosis. Whereas there's others, the other half, the other percent that really are doing nothing about it and only contributing to the future event that's going to take them away. And it's like, wait a minute, let's get to the front end of this. Let's get into the science about why this is going on. How do we diagnose it, identify what's happening, and then do the lifestyle coaching and behavior changes that actually attack the root cause of that disruption.
And you're hitting on the term, one of the terms that I use all the time is root causes. And this actually does come from something called the Baldoni method for heart attack and stroke prevention. And we've incorporated this methodology into our practice. But most people are aware of kind of the basic root causes of heart attacks and strokes, being high blood pressure and tobacco and obesity and diabetes, physical inactivity. But really now we have upwards of 40 different types of root causes that do contribute to heart attacks and strokes. And they're things that you would never think about, such as periodontal disease, migraine headaches, joint problems, gout, psoriasis. These are all definite risk factors for cardiovascular disease. And actually, having had the COVID has been listed as one of the new risk factors for having a heart attack or a stroke. So we can actually expand these root causes and then tackle them all individually and say, okay, we need to clean up this, we need to clean up this. And we want to do this in a very elegant way. We want to use lifestyle medicine metrics, things that we can measure, as much as we possibly can. And I always tell my patients, look, if you can meet me halfway with lifestyle, then I don't have to put so many pills and supplements in your mouth.
Awesome. That's a fantastic way to look at it, because it is one of those where if we were to look at the crystal ball of cardiology, how many millions now of diagnosed COVID cases have there been? And how many are going to continue?
Mm-hmm.
And we're noticing repeat. I mean, people are getting COVID more than once,
Right,
without the idea that how is it going to affect my heart? Especially if I don't have, if I'm rather not aware that I might already be experiencing cardiac disease and not even know.
Well, and
what do you think is going to happen?
Yeah, I mean, what we noticed early on in the COVID is we keep talking about people that have risk factors for the COVID. called comorbidities. What are those conditions? And some of the biggest ones are going to be obesity, diabetes, high blood pressure, heart disease. Those are in the top 5. And then you have your underlying lung problems and autoimmune disease. So 4 out of these top 6 categories here are cardiovascular disease that we actually manage as cardiologists. So when I'm working hard to reduce all those risk factors, we're actually making you harder to kill from the COVID. So it's just a matter of having these healthy bodies and recognizing that we need to have these healthy bodies, because then your risk to fight infection is higher and your risk of having the COVID is actually lower. So it's a big deal. And I really wish that in public health, we'd be paying more attention to some of these modifiable risk factors and educating patients that if they control these things, it makes their risk of having problems with the COVID much less.
Excellent. I think that's going to be an ongoing conversation that needs to be happening. Now, I know we've already talked a little bit about this, but you sound very passionate around his lifestyle changes. What was the trigger, or was there a trigger for you when you were in your traditional model of cardiology? Was there a time where you're like, I can't take this anymore. I have to do it. I have to change. What was that? What led up to that decision?
Yeah, I mean, we were coming off of the 2008, 2009 economic hits to the medical practices, and I was solo at the time and taking all these, getting clobbered with all of this. And so I did what everybody had to do. You hire a professional consultant to come in and evaluate your practice. And so I had to take my 30-minute appointments down to 20 minutes, down to 15 minutes, and then down to 10 minutes. And
so they said, just see more people, just see more people,
it was
actually offer less care, see more of them, keep pumping pills.
Managed care was coming on board, and the average appointment time face-to-face with the doctor at that time was 6 minutes. And I threw up my hand
6 minutes.
I can't do it. And so in 2010, I went to Alternative Careers for Physicians conference in Chicago. I said, I'm out. I'm done.
Yeah.
This was the joy of my life. And I never want to do anything except cardiology.
I mean, she was on the cover of Phoenix magazine before that. Now she's thinking of getting out of the business.
Yeah. As a top doc in cardiology. And now she's like, yeah, maybe not. So when you were sitting down looking at 10 minutes per patient so that you could spend with them, was it because of all the paperwork that you had to do on the back end? Or was it because of the kind of care that you were only able to give? What was it that was the more irritating factor, or the bigger hit to your ethics?
I can't take a medication list in 10 minutes. It's about this. It's about interacting with people and talking with them and not having the freaking computer right there, interfering with the experience. And so, I found out about the Baldoni method, and I found out that I could do a different type of practice here. And we literally jumped off of a cliff in May of 2011. So we've been at it now for a little over 10 years, and we've been full ever since the first couple of years. And it's just been a wonderful thing for patients and so on, with access to time, with access to technologies, with access to us, being able to call us on our cell phone or text us. And it's the joy of my life to do that. Truly it is. So patients can have much more comprehensive care when they have time on their side.
Yeah.
I think that's fantastic. I often quote a study that some radiology students did. And what was so surprising to me was how they kind of came about the study. But what they showed was the accuracy of them reading these radiographic images improved just by having a picture, an image of the person's face. So they would get radiographs, X-rays, MRIs, CAT scans, et cetera, and they would make their readings based on their specialty. And then they would study those, and then they would do the same thing, but with another group that had an image of the person, and accuracy went up. Why is that?
Wow. It's just that's a vested interest. This is a human being. This is someone who's
it's human. It's the human contact, the human interaction, and it's very similar to our models of if I can only spend 10, 15, even 20 minutes one-on-one with you to like you mentioned, I can't even get a medication list in 10 minutes. Like to really get to know what is going on and to even have an attempt to get to the root cause of what's happening. There's just no way it's going to happen in traditional medicine of 10, 15, 20 minutes. We're always going to be treating symptoms, never get to the root cause. They're going to continue to break down, or maybe on a slower pace, but without really any change to who they are, to what they can do.
Now I'm completely spoiled. Our shortest appointment time is an hour, and it goes up from there.
Yeah.
But I still run out of time, even with an hour now. So
no, and really, Dr. Nick, it's unfair to give a diagnosis and a treatment plan or a response when you don't have a full picture. It really isn't fair. So I mean, if when people come to me on the lifestyle side, I'm not going to say, okay, here's the recommendations. Because there are recommendations. There's general recommendations that are out there that some people follow. They just follow them. But it's not fair if I don't know what you do currently. For example, if you have a job that's very active, and you wear a Fitbit or an Apple Watch or have some, and we can track and look at kind of your activity level, you may be getting a heck of a lot of exercise just in your job, where you don't want to waste your time in your busy life at the gym. There's some other things you could be spending your time on, maybe meditation, maybe looking at spending a few more minutes preparing your lunch, those kind of things, where as opposed to saying, well, I've got to go to the gym, right, Dr. Steve? And it's like, no, you don't have to go to the gym. You're getting 27,000 steps a day working for UPS. So don't do that. Yeah, let's get some stress management in there.
I think that's fantastic. Talk a little bit more about the kind of how you're leveraging wearable technology and even technology in general, because I think we even talked about an app that you guys have to communicate, but also interact with and collect data from your patients. It's a phenomenal way to interact. And I think it's the way medicine is going to be going in the future as these things become more advanced. Tell us a little bit how you're leveraging technology.
Yeah, so there is such great technology out there right now, from the watches to the Oura Ring to wear for sleep. To just a number of them. Some ones you put in your pocket, different levels of them. And it's not so much about somebody, keeping track and making sure that you're doing all these things. I mean, there is some accountability involved, but what's nice about it is it's an objective measure that when somebody comes in, I can actually say what they're doing is at a good level. I can even say it's at a too high of a level. For example, she may do a test on them that shows they have some heart damage, and we're trying to figure out why it is. And I look at the information from Garmin or from Fitbit, and I'm seeing them doing interval training 5 days a week at really high levels. Well, they're overtraining. So I actually have to give them a call and say, hey, look, Dr. Feyrer-Melk, and I want you to back off a little bit on your training because it's damaging you. So, and with using an app, you can communicate back and forth. And give information specific to that person. And I'll tell you why it's going to be even more critical. I mean, think of how many text messages people get in a day. Think about how many emails people get in a day. You have to, at some point, start to filter some of them out. So if we are texting them normally all the time with information regarding their physical activity or their nutrition or their stress or their sleep, it gets lost in there. But if we can have an area where it's a pop-up that says, oh, Dr. Steve's texted me or messaged me. It's specific to them. It's about your lifestyle medicine. You know it's important. It's not going to be an ad. It's not going to be something that isn't specific to them. And so it's really a good specific way, because people are busy. Everybody's busy. No matter what you do, you're busy. And so this is what we call asynchronous communication. So I can message them whenever I want. They can look at what I've said, or they have a question and they take their time. They may be standing or sitting in a car picking up their kid at school. They may be, at the grocery line. They can answer or anytime they want that's more appropriate for them. So it's not stress adding. It's not, oh, here's another message from Dr. Steve. I got to get back to him right away. No, when you get a chance, you get back to me and then we can communicate. I can give back feedback for, what information I'm seeing. So it's very powerful.
Excellent. Yeah, that's fantastic. I think it's going to be something that we get better and better at as a medical profession, to start measuring those kinds of things that then will be helpful in diagnosis, but also modification changes.
But it has to be used by the physician or the professional. So here's where the problem is.
Right.
There's a small percentage of Americans that can wear an Apple Watch, wear a Fitbit, and use that as a positive way of intrinsically motivating themselves to do things, okay? Or to keep track of their nutrition. But not everyone is going to use that information in the best way for them, because they're not health professionals. They're not, they're not involved with behavior science. But if you know that the doctor is going to be looking at your step data, and you're going to be more willing to wear your watch. They're actually looking at your nutrition data because they know it impacts what they're doing, so they can take you off of medications and so on. That's a significant part of the benefit of these. But you can see that the use of these is about the same as it is with physical activity and exercise programs. About 3 months and people get rid of them. And that's why you see so many versions coming out, because then they come out and say, oh, maybe if I get a different watch, I'll use it. Maybe if I get a different version, I'll use it. But that's not the case. connect with a health professional and you're way better off and you'll use it more effectively.
Yeah, your implementation of it's going to be better for sure. That's excellent. Now, Dr. Steve, tell us a little bit about your background, because we kind of jumped into Dr. Feyrer-Melk's background with cardiology. Now, where did you come from, and how did this become a passion of yours?
Yeah, so I started a traditional way in the physical education side. That's the side I started on, but then I just kept advancing and getting more into exercise physiology. And then it was time to kick it up a notch. And I said, I want to be in the more medical side, the lifestyle medicine, the wellness, the exercise science, kind of combine those. So I came to ASU to do a PhD, and the number one program in the country for wellness, exercise science. And the key to that, though, and you mentioned it in my introduction, was learning and combining, and that was 30 years ago now, so it's been a while, learning and combining the science behind the application using curriculum and instruction. So what was the beauty of this program was anybody can read studies out there and have a PhD and all these things, but can you then apply it to an individual person, to a real person that's sitting on the other side of your desk or sitting knee to knee with you? And that's where the rubber meets the road. And so I was at ASU for a while, taught there a little bit, and then Dr. Feyrer-Melk was in this kind of hazy time. And I said, well, it's time to start getting to my side, the prevention and wellness side. And it worked. And so now I've got a huge passion, because now I've got somebody who's actually measuring it on the inside. So we really know what's happening.
That's fantastic. And so was there ever an event for you that really triggered you into think like, hey, this is what we have to be doing. This is what we need to be moving towards, because this is where we're going to make the biggest difference. Like for you, what was it that really triggered that passion or inspiration?
I had an event. I was doing interventional cardiology, and I just put a stent in a 50-year-old attorney, and she was brilliant, and we were wheeling her out of the operating room. And she said, Dr. Feyrer-Melk, why is it now that I've had my first heart attack that everyone's warning me about the next one? And my blood just ran cold, because I realized I was telling her that. I was saying, next time call me, next time take your nitroglycerin, next time, because those are the statistics. So 50% of patients with a heart attack are going to have another one. And 50% of those people are going to die with that second event. So our prevention efforts are awful. And you can't just pump people full of metal and fill them up with bypasses to solve the problem. So we have to get down right inside those arteries and heal those arteries. So she still is my patient at this stage. She's not required any more metal in her heart.
That's fantastic. Yeah, that'd be shocking to me. So you mentioned 50-year-old. 50-year-old's not that old. I feel like there's still a whole lot left to go in the 50-year-old's tank.
Right.
Yeah.
And here we are looking at this cardiology event, putting stents in. 50% are going to have another one that they may not survive. What is the research, or even in your practice, suggest, like from a standpoint of longevity, once you've had that, like, when is that second event going to happen? When is, historically speaking, what does that look like?
Yeah. I mean, if we can do the right things, we can what I like to say to my patients is we need to stop the Mack truck. We need to stop the plaque growth and the inflammation and the destruction that's happening inside of the arteries. We have to stop the Mack truck, cool off the arteries, stop feeding the darn things. And then we have to back up the Mack truck. So we actually have data for plaque regression. We can work on that. So we can heal the insides of the arteries. So although these numbers are very dismal when you think about them, there's so many things that we can do. So the hardcore is we have an actual calendar that we follow, where every 3 months we're checking the specialty labs in our patients to look at their inflammatory biomarkers. We do urine tests, we do blood tests, we do dental scrapings. We do this all on a platform of genetic testing too. Is the
dental scrapings. This is fantastic. Has you ever had a test that invasive? This is awesome.
Yeah. So that part is good. And so we're constantly tweaking and fine tuning every 3 months what's happening inside the arteries. And these are measurable. So I can tell the patient, these are our very specific goals over the next 3 months. And this is what we want to have happening to the thickening in your carotid artery. This is what we want to have happening with your labs. And so it's objective. So it's something that we can actually look at and measure. And I think patients appreciate that because they can see how hard are they trying with lifestyle, and are they able to take their supplements, or if they need a prescription, are they compliant with those things, to look and see, what are the metrics here. So if someone wants to stick their head in the sand, and that's what a lot of people do, and just kind of wait for something to happen to them, that's one option. But if you want to be proactive, there are ways to go ahead and look inside the arteries on a regular basis to see what's happening there.
Yeah, and our practice doesn't have the stick your head in the sand kind of people. They're
Right.
not all 100% like, doing everything. They're meeting us halfway. I mean, that's the key, because lifestyle. So the most important thing I did in my research years ago was behavior science research on changing behaviors, and it is still prevalent today, and it's extremely difficult to change behaviors, but they can be changed if you change them in a specific way that has metrics, has support in the way that matches up with the individual. Everybody changes behaviors different. So if I don't have time, if she doesn't have time, it's not fair for us to dictate the behavior change calendar to somebody if they have all their own different lifestyle situations. And there's ways that over the years, with research and with anecdotal evidence, that I think we fine-tuned it pretty well to help individuals. And that's what it comes down to. It comes down to the individual person, and they deserve this individual attention.
I completely agree with you. And what you said really triggered me in the sense of meeting them where they are, identifying the fact that they're coming from a background that is not on the right healthy track for them. It's obviously what's led them to this event. And it's not as though we're just going to take a left turn and be like, okay, now we're doing this. It's like, no, hold on a minute. Let's look at some of the things that we can change, we can help you with. We can offer this medication for these other things. And let's look at a couple of things that we can help you with to make those adaptations. Come back in 3 months. Hey, how's it going? How's it working? Here's the changes that you've been made. Here's the results of these tests compared to where you were here to where you are now. These are going great. Hey, let's maybe add this little thing, or let's make this little adjustment, and we'll remeasure again. Like now it's like it's a low barrier for them to overcome at first. And then these little hurdles get a little bit bigger as they build, and the effectiveness just continues to roll. And I think that that's a fantastic model to work in, especially with this kind of.
One thing that's been very well studied is that fear is not a motivating factor for most patients with taking care of their health. So even though they come in and I can diagnose them with all these diseases and all these problems, the fear of that is not going to motivate them. So what's going to motivate them most of the time, and we're dealing with Phoenix and Scottsdale patients. These patients are smart. They're online. They want information. Perhaps the best word is empowerment. If I can empower them with the data from their own bloodstream and their own body, and show them how we can tweak and fine tune and just take some baby steps to get that cleaned up, and they can own it and they can honor their body up on a pedestal, that's much more motivating than just fear.
Yeah, and the people that come here, they all didn't have an event. The majority of them have never had an event. Mm-hmm. The majority of them have heard about, are smart enough. This whole valley, we have a smart valley. I health-wise, we get outside.
I totally agree with you.
Yeah, and so they're on there Googling, and they're finding, why isn't my doctor checking this? Why isn't my doctor? I should be able to prevent this. My cousin just fell over with a heart attack. Why did that happen? My sister did. Then it's those people that are wondering. They're wondering what's going on inside of me. And I value my reason why to be healthy, why I want to live to be 100. It's because I'm looking for grandchildren. I want to be active. I want to be able to golf till I'm 100. I want to be able to, travel. Their reason why is so powerful. Even though they don't have an event, which they haven't, they still want to make sure that, hey, I'm being proactive, and there's somebody here that can do something about it. And that's what I love, is it gives people that confidence that you can control, you can be empowered, and live the life that you want, that you deserve to live.
I completely agree with you. And those are my favorite people to work with. I love it when we come into an appointment with someone and they say, hey, this is where I was 15 years ago. This is where I see my folks currently, and where I'm going to be in 20 years. And I want to be different than where they're at. I don't want to be decrepit, can't get out of the bed, can only walk to the nearest bench. We have to constantly make arrangements around what they can't do because of where they're at health-wise. And I don't want my kids to be making those same adjustments to their life based on where I'm at. Like, they're smart, that they're able to see down in the future of what does life look like. It's like, excellent. We can work with you because here's some things that we're going to do to help you overcome these things, give you a plan moving forward. And then empower them to make those changes so that they can live that life with dignity and not be fearful of what am I going to turn into if I don't get this taken care of right now.
Yes. And that is scary. That is scary.
It is. And what I love about it is you're right. They don't have that event because they're the ones on the end of it saying, hey, my cousin had this heart attack, and these are all the changes. These are all the things that were affected. Here's how I was affected. And I don't want to place that burden on my family or my kids, or I don't want them to be taking care of me at this age when I can do something now about it. I recognize that now is the time to be anxiously engaged in doing something about it.
I actually heard that exact thing today from a patient. Exactly that. What you just said. So you're spot on.
It's real.
Yeah.
I think most patients are afraid of having a heart attack because they see what it happens. But yet I also think most patients know that, with technology that we have, that we can take care of a heart attack because we've got stents, we've got, bypasses, we've got balloons, we got all this equipment to do. And if you get there in time, we can take care of it. What I think most people are afraid of is a stroke. Because a stroke is really a brain attack. It's the same physiology. It's this ruptured plaque that occludes blood flow. So a stroke is really a brain attack. And that has strong implications for people with their independence and their personality and their quality of life. Yeah. So the things that we're doing to prevent heart attacks prevent strokes too. And then you can have a kidney attack, you can have a leg attack. We don't call them those things, but that's what those things are. But those aren't going to get you on the spot the same way like a heart attack and a stroke would.
No, you're absolutely right. Deep vein thrombosis, the DVTs. I mean, airplane rides. How many times any kind of prolonged sedentary position can then, if you have these plaque buildups or these kinds of poor arterial flow, you're gonna throw a clot. And
we actually have genetic tests now that can tell us whether or not you're predisposed to a DVT, in addition to a myriad of other things. But it's nice for those patients. So then I always tell them, you need to follow the Q1R rule. Q is every in medicine. So it means you need to get up and walk around every 1 hour. It seems like common sense, but you have to apply this, including when you're on that airplane going overseas to Portugal. So
including during COVID, when you're on back-to-back Zoom meetings and you don't have time to even go to the bathroom, you've got to get up and move around.
So it's more important for some people than others, but probably a good general rule.
Yeah.
Absolutely. No, I think that's a great conversation to have. Well, a few more minutes here. What is something you tell your clients or your patients every day or maybe often that you wish you could just record and play on repeat?
Well, mine is consistency.
Perfect.
It doesn't matter how intense it matters kind of what it is. It's more on the positive side of health. It doesn't have to be way on the positive side, but being consistent is, especially as you get older, once you're past 50, consistency becomes even more of an important part of optimal health. And I can use a physical therapy example is, you can go to physical therapy and get your work done, 3 times a week, but to be consistent when you're away from that physical therapist, your best medicine is to be consistent between those, doing the exercises that you're told. And otherwise you end up, 8 weeks down the road and you're wondering why you're not improved. Well, then you weren't consistent with it. And so that's with a lot of these areas, meditation, nutrition, all those things. Now you don't have to be 100%. You have the curbs in lifestyle and you kind of can weave in and out of the center line. You can jump the curb once in a while, but you got to get back on the road. But being consistent for me is the most important.
And for me, that's easy. It's more of a concept. And what I tell my patients every day is I say, cold arteries for warm heart. So we need to do whatever we can to cool off the arteries, keep the inside of the arteries as healthy as possible so that you never have a heart attack and a stroke. So remember, heart attacks and strokes are absolutely preventable. There's no mystery to this. You just need to be able to look inside and see what's happening so that you can do the right things to make the necessary changes.
Excellent. I love it. I think it's great. It's one of the conversations I have often with my patients is, let's talk about what compounding interest for our health. It is that consistency line and that understanding of these little daily changes that we do every day or little daily commitments that we do to either being active, to eating right, to following the plan that you guys would prescribe over time, play off bigger and bigger dividends for you in the future. And I feel like it's the same kind of discussion that needs to be had more regularly with folks who are struggling with some of these health related issues, because it's often lost on them. They want the one thing. What's the thing? What's the exercise to stop back pain?
Yeah.
It doesn't exist. It's the ability to constantly maintain, consistently adapt and maintain to do in order to make those changes relevant.
And it's also important for when I'm working with people is, the end result, is great. And you want that end result right away. You want a certain percentage of body fat. You want to lose a certain weight. But it's the process of what you're going through to get to there. That's the healthy part. That's what's healthy. And you may not enjoy every minute of it, but those are the healthy things that are really adding to your quality of life over time. It's not just getting that end result. I mean, you can go get a liposuction, but if you haven't changed your nutritional habits, you're just going to gain your body fat all back.
And the joy of my life is I love it when patients are able to do those lifestyle changes. And then I'm sitting here saying, wow, this is better. This is better. Let's take you off of this. Let's reduce this by half.
Yeah.
Next, we're going to get rid of this. And we just, take pills.
Yeah. But I think you're absolutely.
Yeah.
That is one of my favorite things is when they come in and say, hey, I'm taking half as many pain pills as it was before. I love it. Like, that's a great objective measure to say, hey, it's working. We're on the right path.
That's right.
I was taking 4 yesterday, and now I've taken 2, I've taken 1, or I didn't need anything to sleep. That's one of my other favorite things.
Wow. Shocking. Yeah, that's huge. And sleep, we don't want to get into that, but that's a huge one. So if you keep them pain-free so they can sleep, that's a big thing for their optimal health.
Absolutely. It plays into a lot of things. It's been fantastic. Absolute joy to have you on the show today. Thank you so much. What's an easy way you can tell our listeners to get a hold of you? How do they find you?
Just optimalheartcenter.com.
optimalheartcenter.com. Excellent. We'll include a link. That's fantastic. Thank you guys very much for being on the show. Really appreciate it. We look forward to future discussions.
Thanks for having us.
Bye-bye.
Bye.